survival is nearly twice as good as with radical surgery, and again, avoiding the complications of robotic or open surgery. So give us a call if you wish, or better yet, come in, make an appointment, spend some time, invest some time, learn about all the options, and then make your decision. We're going to hear from our sponsor, and then we'll be right back to take more of your calls and questions and provide more information to you. So here is the man with the platinum-plated golden voice. Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day, because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back. We're back taking your calls. Give us a call if you wish. 800-848-9222. 800-848-9222. So there's a new study that shows that chemo doesn't necessarily get to the cancer. Can you believe that? Now, usually when chemo is given, it's given into a vein, and the vein goes to your heart, and then it circulates the chemo throughout your body from head to toe. So there's a new study, and it was described in a publication this week that shows that CAT scans help to evaluate whether the chemo even gets to the cancer. So there's an article in a journal called the Journal of Clinical Investigation by COE, and it looks at how CAT scans, show if chemo even gets to the cancer. And it's the first human study, they say, to address the issue of whether chemotherapy gets to pancreas cancer. So they infused intravenous dye in the CAT scan as if it were chemotherapy getting into a cancer. Now, pancreatic cancers contain disorganized or non-functional blood vessels and fibrotic tissue and variations that can create barriers for chemotherapy to get to the target. Now, the authors say, quote, chemotherapy is used every day. However, we've done very little to demonstrate that the drug actually reaches the tumor efficiently, Dr. Fleming says. Results from our previous trials taught us that when chemotherapy kills most of the tumor, the patient has a better chance of being a long-term survivor than if the chemo doesn't even get there. Well, wow. You think you're getting chemo going to your vein, and it goes to the tumor, and then you find out the chemo's going everywhere but the tumor. And that's just the opposite of what we do. Radiosurgery is getting the treatment to the cancer. We find the cancer. We computerize the cancer. We make a stereotactic frame of the patient. We then have physicists and dosimetrists and physicians and technologists who all work together to focus the beam on the cancer. And that's why our success rate to stop or shrink or make that cancer go away that we treat over the patient's lifetime, about, on average, 90%. So, wow, no wonder so many people prefer stereotactic body radiosurgery. It gets to the cancer. It hits the cancer. We don't have to worry about the blood diverting the scar tissue and going somewhere else, and you lose your hair, but it doesn't help treat the cancer. No, Radiosurgery does just the opposite. It gets to the cancer. So this is a great paper, and it's a paper that we've been talking about, that chemotherapy, even if it goes from head to toe, may not get to the cancer. Another consideration, another reason why stereotactic radiosurgery at New York Radiosurgery. It gets to where you want it to go. It gets to where you want it to go, to the cancer. Hit the cancer. There's another study that was done about how you can avoid unnecessary surgery. So we just talked about unnecessary, or let's say chemo that may be less than useful. So there's another article that was evaluating the use of staging in lung cancer. Now, we've talked a lot about staging. Staging means, where is the cancer? Where is the cancer? Do you have cancer? Where exactly is the cancer? So, here's a new article by Charles Bankhead, who's a staff writer for MedPage. And he writes, routine preoperative PET scanning led to a significant reduction in unnecessary surgery for lung cancer patients in a review of about 1,000 cases. Overall, the rate of unnecessary operations, defined as discovering of metastatic disease during surgery, decreased by 13%. After adjustment for confounding factors, unnecessary operations occurred almost 50% less with preoperative staging. This time talking about PET staging. So imagine you can reduce surgeries by 50%. Reduction, unnecessary operations occurred 50% less often if there was staging. And we see this every day. Every day. Often surgeons may be recommending surgery without complete staging. Without staging, you don't know where the cancer is. If you have staging, your recommendations probably will change a lot, and you may offer other evaluation besides surgery. And if you know where the cancer is, you know how to better treat the cancer. And 90 days later, you know how to better evaluate the cancer. If you don't know where the cancer is today, how can you down the road evaluate the response to treatment? You can't very well. So cutting corners today causes chaos tomorrow. And you can see that by better knowing where the cancer is, you can avoid unnecessary surgeries, which means unnecessary treatment, which means unnecessary complications, and have a better chance at more successful treatment in your situation or your loved one's situation. So it only makes logical thought and outcome. To know where something is, especially cancer, means you can better deal with it. So, again, give us a call. If you want to know where your cancer is, give us a call at 212-CHOICES, 212-CHOICES, which is 212-246-4237. Best is to come in, spend an hour or so, and learn about all your options and how to best evaluate and treat your situation. Guess what? Not surprising, something we've talked about. The Boston Globe this week, in an article by Tracy Jan, talked about how cancer doctors and big cancer centers lean on pharmaceutical money and how that money can corrupt the industry. So Tracy writes, cancer institutes across the country are relying more heavily on pharmaceutical industry funding for research as the proportion of federal support shrinks, raising concerns among scientists struggling to compete for the next oncology breakthrough. And at Boston's Dana-Farber Cancer Institute, where I trained, spent 6 years of my life in Boston at Harvard Medical School, industry money makes up nearly a quarter of its research support, compared to about 10% just a decade ago. So it's more than doubled in 10 years. And the Boston Globe survey of major cancer institutes shows that the shift at the Dana-Farber reflects a national trend. Now, the chief scientific officer at Dana-Farber, Dr. Barrett Rowland, said, I worry the type of research is shifting. Government is really the only entity that can support unfettered research because it recognizes that there may be a great time lag between a discovery and its application that benefits society. Shareholders would not want a company to think that way. He went on to say, company-sponsored research is really about benefiting a company. There's a high expectation of a practical outcome over a short timeline. And that's what we've been talking about. A private cancer treatment center like us doesn't think about benefiting the pharmaceutical company. It thinks about benefiting the patient. It's there for the patient. It's not getting money from the pharmaceutical industry to push drugs. Sometimes people ask me, well, why do I only get chemo offered when I go to XYZ Cancer Center? Well, think about it. If the chemo people are giving tens of millions of dollars, they probably expect something in return. Doesn't that make sense? Does it surprise you? Does it surprise you that cancer centers are getting tens of millions of dollars? Now, in the article by Tracy, she writes, at Dana-Farber, the primary reason for the shift towards industry support is driven by scientists desperately seeking alternative sources of fundings, says Rollins, who even expressed concerns, praised industry for stepping up to plug the gap. Whereas a decade ago, many scientists frowned upon industry collaborations with the pharmaceutical industries, the new focus is making research more applicable. And cancer centers are an appealing target for pharmaceutical company largesse. So, if 60% of the money goes to clinical trials, which is said in this article, it means that a lot of those clinical trials are drug trials. So many times people ask me, well, why are the drug trials there? If chemo's not good, why is well, think about it. If there's tens of millions of dollars of money that's flowing to the cancer centers, what kind of clinical trials do you think you're going to sign up for? And are clinical trials what you really want? Do you want to get involved in a clinical trial that maybe only has theoretical rationale rather than have the best possible treatment that's known for you? So these are questions that we address when we meet the patient in person, when we go over all the details. Do you want a clinical trial? That's great. But understand what a clinical trial is. It may be supported by the drug companies to promote the use of chemotherapy. So if the drug companies are sponsoring the chemo and sponsoring the studies, and you want to go to one of those big cancer centers, you're probably going to get an investigational chemo approach. It only makes sense. And if you want to avoid chemo, or if you want the best known treatment, you probably have to go someplace else, a place that's devoted to your care and your life, and most importantly, you. And that's why we're here. We're here for you. We'll be back in a minute. We're going to hear from our sponsor. We'll be right back again. We're live at the WABC studios. If you have questions you want to talk about or topics that you don't find on today's program, just give us a call at 1-800-848-9222. 1-800-848-9222. For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you with body radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212-CHOICES. 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212-CHOICES. 212-CHOICES for Radiosurgery New York. At Radiosurgery New York, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason